Hey everyone, welcome to the Happy Flosser podcast. My name is Billy Lunt. I am your host, and I'm here to talk to you about all things dental hygiene to support you on your journey through the dental hygiene program. It is so great to be with you today. I hope that things are going well for you in your studies and learning to become a dental hygienist. And I've gone through all of my episodes just to see kind of where I'm at as far as content and each topic to see, okay, where do I need to record more content so that students can just scroll through all of the different episodes to get exactly what they need. You know, I have a lot in community, oral anatomy 1, oral anatomy 2, some clinical stuff. And so I want to make sure that I'm covering all the different challenging areas for you so that if you're struggling in a specific class, you can just scroll through and look for the episode that you need to support you in that moment that you're in on your learning journey so that whatever's going on, whatever test or assessment you're getting ready for, I can support you in any way. So I noticed that I only have 5 episodes in radiology, so I thought I would add a couple more episodes in that. And there's a couple of different courses that I need to add more content for students. Students reach out and ask. I put it on the list, and eventually I do hit the record button. So today we're going to talk about the biological effects of radiation for your radiology course. This is important information that you need to know to be successful understanding really how radiation works and the effects that it has on the body. And this is information that patients might ask you about. It's information that will be on your board exams, and it's really stuff that you just need to have a good understanding about, especially because you're going to be the one taking these x-rays. So it's really important for you as a dental provider to understand what the effects of electromagnetic radiation, including ionization radiation or living system, has on the body. What are the effects of that? Now, all ionizing radiation is harmful and does produce some level of biological changes in living tissue. But keep in mind, the amount used in the dental field is really minimal compared to other ionizing radiation. Like, let's think of nuclear or the atomic bomb would be probably the whole other end of the spectrum. But biological damage occurs even at the minimal from use of x-rays. And these are the things that patients will be asking you about. And we do have a couple of theories to really look at how cells are impacted. So the direct theory is that cells are impacted when ionizing radiation hits the critical areas of the cell. The photon directly strikes the DNA of a cell. This occurs really infrequently, but then there's indirect theory, which is something that probably happens. So these are the two theories, direct and indirect. The cells absorb the X-ray photons and the toxins are formed as a result of that absorption. And then those toxins actually damage the cell. And this occurs more frequently. Remember that cells are composed about 70 to 80% of water. So the X-ray photons are absorbed by the water within the cell. And then free radical formation results. So that's a word that you want to understand when you're talking about indirect theory and biological effects of radiation on the body. So the free radicals combine to form the toxins. Those toxins cause cellular dysfunction and damage. So the damage from free radicals combine to form the toxins, not from the direct hit of the photon. So that's an important understanding of that particular theory, that indirect theory. So think about how it's like a cascading impact. The other thing you want to think about is the type of cells. So if we're talking about somatic cells, those are all body cells except for the reproductive cells. And these somatic cells, they can repair themselves. The recovery rate for somatic cells is about 75% during those first 24 hours after being exposed to radiation in a healthy person. And if the damage isn't repaired, it's seen in the person that's exposed. Damage is not passed on to the next generation for the somatic cells. When we're talking about genetic cells, those are the reproductive cells, the sperm and the ova. They cannot repair themselves. And the damage is not seen in the person exposed, but it is seen in the next generation. So hopefully you can make that distinction between the somatic cells and the genetic cells. The genetic cell damage may be passed on to the future generation as it matures. So we're going to talk about a couple of laws. Now that we've talked about the radiation itself, the different theories, now we'll talk about the laws. So radiosensitivity of cells, it's directly proportional to their reproductive activity and inversely proportional to their degree of differentiation. So what does that mean? It means that the cells that rapidly divide or have the potential for rapid division are more sensitive to radiation. The non-specialized cells are more sensitive than those that are highly specialized, so those primitive or non-specialized cells. Now, within the same cell family, the immature forms, which are generally primitive and rapidly dividing, are more radiosensitive than older, mature cells, which have stopped dividing. So the way to think about that is think about the like humans, adults versus children. Children tend to get sick more. They tend to be a little more vulnerable. So think about primitive or immature cells. Same thing. They're more reactive to or sensitive to the radiation. So the radiosensitive cells or the immature cells, these are things like your blood cells, reproductive cells, lymph tissue, bone marrow, all the things that make up things like your thyroid, the lens of the eye, your skin, your critical organs. These are the radiosensitive cells. These are the cells that we want to protect. And then there's radio-resistant cells. Those are the slowly dividing or no longer dividing mature cells. Those are specialized cells like the ones in muscles and nerves and salivary glands, your kidneys, your liver. So think about your face and the head. The facial and oral structures are mostly made up of bone, nerve, and muscle tissue. And this is where we're focused, right? This is our focused concentration when we are taking images anyway. And this is all in an area where it's mostly mature cells. So think about the factors that determine radiation injury. It's total dose, the area that's exposed, the dose rate, the cell sensitivity, what cells are you exposing, and then the age of the patient. That is also important. The total dose is how much radiation is received, and a large dose obviously is more harmful than a small one. And the total dose depends on the type, the energy, and the duration of the radiation. And the greater the dose, the more severe the probable effect is. So that's kind of a logical understanding of total dose. When we talk about dose rate, we're talking about how often a certain amount of radiation is received, right? So the dose rate over the dose time. So how long, how much? The high dose rates are more harmful than low rates because there's no time for repair to occur. The body can't actually repair and recover from it. And a given dose will produce less effect if it's divided time. If it is divided, that means that it allows time for recovery between dose increments. Let me give you an example. And this principle is utilized to determine the dose for radiation therapy. Let's think about radiation therapy. We have that as a major on our campus. So maybe you have some friends that are in that field. But an exposure of 1 roentgen per week for 100 weeks would result in less injury than a single exposure of 100 roentgen. So it's the same amount of radiation, but there's time for recovery in between those dosages. So hopefully that makes a little more sense to you as far as like how recovery works. Cell sensitivity, what type of cell was exposed? More damage occurs in those radiosensitive cells. And then the reason why age is important, the children and the elderly are more susceptible. Children have more rapidly dividing cells, and the distance from the oral cavity to the reproductive organs is less than it is in adults. So the dose to this area may be higher. And then geriatric patient cells, they do not rapidly repair as easily or as quickly. And that's why it's really important to know who your patient is and what their history is and what their exposure level is. So, sequence of events following radiation exposure. There's a latent period. There's the period of injury, and then there's the recovery period. The latent period is the period between exposure and the first sign of the effects of radiation. Now, it may be minutes, it might be a short period of time, it might be days or weeks, or maybe even a long period of time, years, decades, generations. Short-term effects are things like radiation therapy. And then long-term effects are linked to the of cancer, birth defects, and other issues that reveal themselves in a generational sense. The period of injury is when the effect of the radiation is visible. The effects that you can see include things like the stoppage of mitosis and formation of abnormal cells. Now, this may be temporary or permanent depending on the radiation dosage to the patient. And then the recovery period. So some recovery can take place, especially in the case of short-term effects, right? Nevertheless, there is a certain amount of damage from which no recovery can occur, and its damage can give rise later to long-term effects. Now, stochastic effects are effects where the risk is proportional to the dose. It implies that there's no threshold. The more exposure, the higher the risk of independent dose. Example of that would be cancer. Genetic effects. Severity of the effect of the independent is independent of the dose. So that is your stochastic effect. These are the biological effects from radiation, and they're classified as either stochastic or deterministic. Deterministic effects, those are the non-stochastic effects. Those effects are where the severity is proportional to the dosage. It implies a threshold that takes a certain amount before the effect occurs. Things like cataracts, radiation burns, sunburns. These are deterministic effects. The other thing I want to discuss is dose response curves and radiation injury. Radiation dosages can be plotted on a graph to illustrate the probability of tissue response or damage. Plotting the two variables, the amount of radiation and the anticipated response of the tissue, creates a dose response curve. Now, the threshold for somatic cells, no response until a certain point. Once it's above it, the response is produced. And then a linear non-threshold would be a genetic cells, and that response is directly related to the dose. So any dose, no matter how small, has the potential to cause a response. That's important for you to know. There is no safe level of radiation in dentistry, even though the dosages, sorry, that word is hard when you're trying to say it. Even though the dosages are extremely low, some biological damage occurs. And I think we're all guilty of saying, well, let me just take a quick image. I'm just going to take a quick image of that. Even like my daughter went to the orthodontist, and she had just had a Panorex taken at the dentist because they were they were extracting a primary tooth. And they said, oh, we just have to take a panoramic x-ray for her consultation for braces. And I said, I just had one done. Oh, it's no big deal. It's part of the workup. And I said, I have it on my phone. I will email it to you. I did not want her to be exposed to an additional Panorex, even though the dosage was low. Was unnecessary. So let's get back. Short-term effects. Short-term, short latent periods that are seen in minutes, days, or weeks. You would have large amounts of radiation that are absorbed in a short period of time. Usually it's like a whole body exposure. And you can have what's called acute radiation syndrome. So nausea, vomiting, diarrhea, dehydration, hair loss, right? So think about your cancer patients that are going through some kind of radiation, short-term effects. It's not really applicable in dentistry because we can't produce enough radiation from our machines to actually cause those kind of acute radiation syndrome. So any kind of like nuclear accident would cause this situation. I just watched a Star Trek episode where he had to go into the core meltdown and realign the beam. Scotty was saying that there wasn't enough power, and by going in there, he was exposed to a high dose of radiation. So he had acute radiation syndrome in this episode that I happened to watch. And of course, they just laid him out on a table and they put all these little really futuristic things on him and he was all better. But if you think about something acute, it happens instant, like fast. And so the body just can't handle the healing pieces that are required for. Now, long-term effects, there's a long period. There's small amounts of radiation that are absorbed repeatedly over a long period of time. And these effects are seen after years, decades, generation. It's usually a localized dose. The effects of chronic exposure, right? So cancer, cataracts, birth defects, and some examples of that. It's a higher incidence of certain cancers, things like stomach cancer, bladder cancer. And those are your long-term effects of continuous low dosages of radiation. Keep in mind that there is background radiation in our world. And it's really quite remarkable when you start thinking about all the things that have to occur for us to be able to live on this planet. Even though we are exposed to radiation, it's a low enough dose that we can still live here and we're safe. But it's also something to keep in mind when you are looking at background radiation and thinking about having a respect for radiation, I guess is the way that I will frame it. Because the exposure to the population, it's important to know, is it changing? Is it something we monitor? Of course it is. And does that change over time with our changing environment, with our ozone, with our carbon footprint? Are those things that are impacted? And does that change the health of the population? And it absolutely does. We have to be really mindful of just how much the environment around us impacts our living space. And so those are the types of things that are important for you to know as far as long-term radiation effects and what the environment provides, and then also what we need, what is a safe level, so that we can get accurate assessment of our patient, but not overexpose our patient, because we want to be really respectful that radiation can be dangerous, and even a small dose of radiation over a long period of time. So these are things that patients will mention to us. I know that when you're in school, you don't really, you're not really X-rays as much as when you get out into the real world. I guess I'll just call it the real world. When you get out into the real world, patients will refuse radiographs. So it'll be important for you to have those conversations, be respectful and understanding of where that patient is coming from, but also having the knowledge and understanding of the biological effects of radiation and understanding the risk level for your patient will make you more to be able to have those conversations with your patients, so that you even have kind of a mindful eye of what is an adequate amount of radiation? What is the ALARA principle? What can I use so that I know that this patient is getting adequately diagnosed and we're doing the lowest number of x-rays possible to keep them healthy for the long-term effects? So this is why it's important for you to understand biological effects of radiation. That is it for today. I hope you guys are having a fantastic week. I hope things are going well for you. If you need any support at all from me, you can always click the link in the show notes. There's study sheets on all of this content. And as always, if there's an episode or content that you need covered, you can always reach out to me with an email. And I hope you have a great week. I'll talk to you soon. Bye-bye.